For this video, we'll combine two separate species of the strep genus, Strep pneumoniae and the viridin streptococcal species. This illustration is titled the Alpha Knight Tournament and takes place at a medieval jousting tournament. So we'll start by drawing the jousting arena. It's called the Alpha Knight Tournament because both of these species are alpha hemolytic. Remember, both Group A and Group B strep are beta hemolytic, so this is one of the first distinguishing features. Alpha means it's a partial hemolysis, in which the surrounding zone of hemolysis has a green hue. This green comes from the oxidation of hemoglobin. We've made the alpha on the sign green to help with that association. First, we'll draw our defending champ, the Strep Pneumo Knight. He's somewhat of a badass. He's defeated all other knights, so he's known as the #1 knight, or Strep Pneumo is numero uno, if you will. Numero uno. See what we did there? Well, like any knight worth his salt, he's encapsulated in some pretty sweet armor. So Strep Pneumo is encapsulated. It's actually a polysaccharide capsule, which is its major virulence factor. Sir Pneumo takes safety very seriously, so he also wears a helmet. So you see he's super secure and protected everywhere except for one weakness, and that's his chin. His chin's the only part of his body that you see that's exposed, so his chin is sensitive. Use this to remember that Strep Pneumo is optochin sensitive. Optochin is a chemical that inhibits the growth of Strep Pneumo, and as you'll see, viridins is optochin resistant. Strep Pneumo has a characteristic shape under high-power microscopy. It's said to look like a lancet-shaped gram-positive diplococci. To visualize this, we're going to give numero uno a second lance, so you remember diplococci, and the lance will remind you of the lancet shape. Another identifying attribute you may be given in a question stem is that Strep Pneumo is bile-soluble. It cannot grow in bile. Try thinking of all this mud here on the ground as bile. We're going to put mud all over the horse's legs, and as it struggles to walk through it and gets all mixed up in the mud, this should remind you that Strep Pneumo is bile-soluble. Now we'll move on to cover some clinical findings in a Strep Pneumo infection. Strep Pneumo causes pneumonia. It's actually the #1 cause of community-acquired pneumonia in adults. It's characteristically a lobar pneumonia that generally infiltrates the lower lobes. It's also said to lead to the production of rust-colored sputum. And to remember both of these, we'll draw one lobe of the armor on the knight's chest covered with rust. Again, this is rust-colored sputum and lobar pneumonia. Strep pneumo is the #1 cause of a lot of different diseases. Rather than coming up with a separate visual cue for every disease, we thought it would be better if we added a visual reminder for a popular mnemonic that you guys already might know. And this mnemonic is MOPS, where M stands for meningitis, O stands for otitis media, P stands for pneumonia, and S stands for sinusitis. Again, Strep Pneumo is the most common bacterial cause of all of these. So we'll give Sir Strep Pneumo a squire, and we'll have the squire mopping up this muddy mess. This mop will remind you to use the MOPS mnemonic. We'll also draw one of Sir Numero Uno's fans holding up a #1 sign. This will remind you that it's the #1 cause of all of these diseases. Strep Pneumo has another virulence factor other than his capsule that helps it evade our immune system. It's a protease that cleaves IgA, which is important for it to be able to colonize and invade our mucosa. To remember this IgA protease, we'll give Sir Numero Uno a shield with the symbol of an IgA dimer molecule. The shield looks cracked and damaged, which in general should make you think of reducing host defenses. A recurring theme in microbiology is that individuals who have had a splenectomy, or an autosplenectomy as in the case of sickle cell disease, have a greater risk of being infected by encapsulated organisms. This is because the spleen plays a major role in the removal of encapsulated organisms from the body. To help you remember that patients with sickle cell disease are particularly susceptible to strep pneumo infections, we'll strap a sickle onto Sir Numero Uno. So as far as treatment goes, there are really two first-line choices. Most pneumococcal infections are susceptible to erythromycin, a macrolide. We'll remember the macrolide with our macrolide symbol, these crows. Crows in macrolide. We'll draw them up here hanging out and watching the event. Another option would be to use a third-generation cephalosporin like ceftriaxone. We also have a special symbol for ceftriaxone which we'll incorporate in future stories. It's this, 3 axes, or our tri-axe symbol. Tri-axe will remind you of ceftriaxone. I think the symbol fits pretty conveniently in this picture. Prevention is a really important topic for strep pneumo. There are 2 pneumococcal vaccines you really need to know. One vaccine is for adults and the other is for children. The adult vaccine is a 23-valent polysaccharide vaccine, and the children vaccine is 7-valent, however it's conjugated to a protein. Since the adults are given a polysaccharide without a protein, our immune system generates a T-cell independent response, which only really creates IgM. IgM, as you know, does not provide a long-lasting protection. By conjugating the polysaccharide to a protein, as in the children's vaccine, it becomes more antigenic and generates a more robust T-cell response, which leads to the production of IgG. So overall, one more time, the 23-valent adult vaccine only causes an IgM response. The 7-valent vaccine for children causes an IgG response. We'll remember this by drawing this sign here telling people where to sit. Adults are on the mezzanine and children on the ground. M in mezzanine will remind you of IgM, and G in ground will remind you of IgG. And as soon as you remember which produces the IgG and which is IgM, you'll be able to work backwards and pick the appropriate answer for one of the more immunology-related questions on strep pneumo. Alright, that's it for strep pneumo, but we still need to learn about the challenger, and that's going to be strep viridans, and he'll be on the right side. We decided to go for the jester theme for strep viridans just to really make sure that they're distinct. Strep viridans is alpha hemolytic, that's why he's in this tournament, but there are ways to differentiate viridans from strep pneumo. First, as you can see, the jester has no armor on. So as strep viridans stares down strep pneumo, who has a full coat of armor, use this contrast to help you remember that strep viridans has no capsule. The second major point of contrast to strep pneumo is that strep viridans is optochin resistant. Remember, pneumo is optochin sensitive. So to remember this, we'll have our jester protecting his face with a jester's mask and really exaggerate the chin to show that it's protected by the mask. Finally, the last point of comparison, you'll notice how relaxed and confident this donkey looks. It's because he isn't fazed at all by the competition, nor by the mud under him. The mud isn't bothering him because he has these snazzy green bile-resistant boots on. Remember, strep pneumo is bile-soluble, and viridans is bile-insoluble. And keep these bile-resistant boots in the back of your mind because they're going to show up again in the next video. The viridans group, specifically strep mutans and strep sanguinis, are commonly associated with dental caries. To remember dental caries, we're going to give this donkey some really foul, yellow teeth. And if a viridans like strep sanguinis gets into the blood, it can cause subacute endocarditis and damaged heart valves. This most commonly occurs in the mitral valve. But before we give you an easy mnemonic to remember that it's the mitral valve that's most commonly affected, let's think about why it's the mitral valve. I said it commonly affects damaged heart valves. Which valve is most likely to be damaged in the general population? The mitral valve. First, there's mitral valve prolapse, which is a very common condition affecting 2 to 3% of the population, and there's also rheumatic fever, which we discussed earlier. So now that you really understand it, we'll add this same mitre hat, or Pope's hat, we used in the strep pyogenes video. Mitre for mitral valve, and we made it look a little damaged too, to remember that viridans only affects previously damaged valves. Now I'm going to walk through the pathogenesis of how strep viridans is able to infect damaged heart valves. Let's say someone with a previously damaged heart valve, like mitral valve prolapse, has their teeth cleaned, and now a bunch of viridans group strep enter the bloodstream, causing a transient bacteremia. Strep viridans is able to adhere to any fibrin platelet aggregates of damaged tissue by creating dextrans from glucose. To remember this, instead of giving the jester a shield to defend himself, we'll just stick a plate to his arm. So this adhering plate will remind us that viridans adheres to platelets, and the jester holding the deck of cards will remind us of dextrans that are the actual glue that makes them stick to platelets. That's all we have for viridans, and with that we wrap up the strep pneumo and viridans combo, a 2-for-1. Hopefully by putting them side by side will help you remember the differences so that you'll really be able to distinguish them on test day. In the next video we'll talk about enterococcus.